Hi, my name is Cody Fleck, and I will be doing my Foley catheter checkoff on a female today. Her name is Alexis Fleck, and her date of birth is 11/5/98. So first, I would log into my doctor's orders. I would check the provider's orders, why the catheter needs to be placed, the reason behind it, the size of the catheter, the sterile technique behind the catheter, the education the provider wants me to give to the catheter, the time he wants me to place the catheter. I would look at all of that, making sure all of that is set up before I go into the patient's room and making sure I have the right patient. I would make sure to look at all the orders completely and fully before entering the patient's room. And I would also gather all my supplies and have them ready right before entering the patient's room. Now I would knock. Hi, Alexis. My name is Cody, and I'll be your nurse today. First, can I get your name and date of birth? And she would say, Alexis Fleck, 11/5/98. I would say, okay, let me check the provider's orders. I would check the provider's orders one more time, making sure I have the right catheter. I'd check the catheter bag. I'd check the expiration. I'd check the size. It's a 14 French, 10 millimeter catheter. I would make sure all of the sizes, all the expiration dates are good and ready to go. And then I would start educating the patient. I would tell the patient, hi, I'll be your nurse today, and I'll be placing a Foley catheter into your vagina to help you urinate. I would explain the procedure, explain how it might be a little painful, but just let me know. I'd assess her pain right away. So I'd ask, hey, are you in any pain, Alexis? She would say yes or no on a scale of 1 to 10, and then we could assess that. And if she's not in any pain, I can continue with the procedure. I would explain the procedure, ask if she has any questions, and then I would also tell her if you're in any pain or discomfort during the procedure, just raise your right hand and we can talk about it. We can pause or we can stop the procedure. I would make sure that she feels safe and ready to begin the procedure. I would ask her if she has any questions. Alexis, do you have any questions today? No? Okay. And then I would assess the patient. I would look at her vagina. I would make sure to get soap and water and clean up her vagina before starting the procedure. I would make sure to want the vagina completely clean of debris, feces, urine, any of that, blood. Want all the vagina completely clean. And then this is a sterile procedure, but we will begin the sterile procedure in a minute. So first, I would grab some gloves and assess the vagina. These are non-sterile gloves. So I would look at the vagina, assess the labia, identify the clitoris, the urethra, and the vagina. I would look at the labia, making sure everything is normal, documenting color, discharge, urine, any of that. I would make sure to want to document all that after my procedure. So I would have the female sit leg up with, or sit laying down with her legs spread, eagle, making sure I have the best opportunity to see the whole vagina. So then I would take a non-sterile chux and I would lay under the patient, just so if there's any leakage or urine, I can clean that up and we don't have to have a bed change. So then I would come in here, and before I did all that, I would provide privacy and do hand hygiene. So I would place the drapes, provide privacy before I even look at the vagina. Hand hygiene. And then we would be ready to start our procedure. So first, I'm going to open the sterile kit without infecting anything, breaking the sterile field. So I'd want to touch the flap without breaking the sterile field, making sure it doesn't touch anything, making sure that there is a 1-inch border around the whole entire sterile field without being touched. So I don't want to touch any of that. Take my hand hygiene. So first, I'm going to take my gloves, my sterile gloves. I have 2 pairs here. There's a large and extra large. So I would discard the large, have the extra large, sterile. Making sure to come over here and not touching any of the borders. Making sure that there's a 1-inch border around the sterile field of the gloves. I would grab the gloves and place them on my hand. Making sure not to infect anything. Okay, now that I have my sterile gloves on, I can adjust any of my arms. I would just swipe the gloves on the ground, making sure my hands stay clean. And now, since I have sterile gloves on, I can mess with all of the materials in my kit. So I would discard the sterile chux and drapes. I would discard them in the garbage without contaminating my sterile field. So now I can open this. So now I have my cleaning supplies, my lubricant, which I would open my lubricant and place in here just so I have it ready. And then I will open my iodine cleaning wipes. Placing here. Have my catheter right here. Making sure everything's normal. I'll discard anything I need without crossing my sterile field. Right away, I'm just gonna hook up the solution to my catheter just so I don't forget. And now, since I have everything ready, I will use my non-dominant left hand to clean the labia. So look at the labia. I would first start away from me and go down the labia. Discard in the garbage without crossing my sterile field. The second one, I would go on the labia closest to me, down, making sure to clean and disinfect anything around the labia. Discard this without crossing my sterile field. Last one, I would take the last iodine swab and go right down the middle, front to back, cleaning the clitoris, the vagina, and the urethra. I would discard this without crossing my sterile field. Now, my left hand and right hand. So now I can take my right hand and I'd lubricate this. And I'd ask the woman, okay, now we will be placing the catheter in your vagina without contaminating anything. I would place the catheter in the vagina, making sure she takes deep breaths as I'm placing it. I would go until I see urine in the tube, and then I would go 2 inches further, 1, 2, and then I'd place the urethra, and then I would inflate the tube, making sure not to contaminate anything. And if I did contaminate anything, I would start over with this whole procedure. I wouldn't use my left hand. So I'd be inflating the tube. Perfect. I would take the tube off. Ask her if she's in any pain or discomfort. I would assess the tube. I would pull down just to make sure the tube is in place in the urethra. At this point, I should see urine in the tube, and I would look to see if I see any blood, discomfort. I'd ask the patient's pain level. I would document the amount of solution I used for the tube, the bubble. I would ask the patient if she's in any pain, making sure that she's comfortable. I would document the amount of urine that came out right away, making sure it's not too much. I would make sure that the patient is comfortable, put her in a comfortable position, hang the bag lower than the bladder, so I'd hang it on the side of the bed, and I would place it on her leg securely so it is comfortable. And then I would take my sterile gloves off, clean up, hand hygiene, making sure the patient's comfortable. Now I would come into the room. I would ask the patient, hey, or I would tell the patient, hey, we are going to be removing your catheter. and I would check the provider's orders. I would make sure that the provider has stated when the catheter needs to be removed, the date that the catheter needs to be removed, the reason that the catheter needs to be removed. I would make sure that's the right patient. I would do all that, and then I would come into the patient's room, knock, provide privacy, do hand hygiene, educate the patient on that we will be taking out her 14 French catheter today, that she doesn't need it anymore, that the doctor provided us to take it out. So then I would assess the vagina, making sure that there's no blood, any discomfort around the vagina, the catheter is attacked and placed in, good. So then I would do hand hygiene. I would put my gloves back on. I don't have a pair of clean gloves, so I'm just gonna say I would have gloves on. And then I would assess the vagina, making sure it's all clean of debris. And then I would take the syringe and I would deflate the balloon, making sure I get as much water back as I placed, asking if the patient's in any pain while I'm doing this, and I would pull the catheter out of the vagina. I would discard this per policy of the facility. I would detach from the leg. I would make sure that the catheter is detached from the leg. I would inspect that the catheter didn't cause any damage, any skin breakdown, anything like that. I would look at the catheter strap and making sure the catheter strap didn't cause any damage or skin breakdown. I would assess the vagina, making sure it is clean, looks good, no blood, discharge, any discomfort. I'd ask the pain level of the patient after the procedure is done. I would ask if she's in any pain, if she's in any discomfort. I would document, first for the catheter placement, I would document the size of the catheter, the reason that they place it, the education behind the catheter. I would document any urine that has been put out, the amount of urine that has been put out, any blood or discharge that has came out with the catheter. I would document any discomfort, any pain during any of the procedures. I would document how the patient took the procedures. And then for discharge or for removal of the catheter, I would document why the catheter needs to be removed, when the catheter was removed, and I would also document when the catheter was placed and time and date in my signature. And then I would document when the catheter was removed, why the catheter was removed, the reason behind everything. I would document how the patient took the procedure, any blood, discharge, pain after the procedure. I would document how I disposed of the catheter, and then making sure to document anything else the patient has concerns with, making sure that the patient is comfortable, safe, good, making sure the patient is in comfortable bed, making sure if she has to go to the bathroom now, I will take her to the bathroom. I would place her call light in her hand, ask her if she needs any drinks, any beverages, anything that she needs, so she doesn't have to get up or anything like that. I would make sure to document everything. I would make sure to do hand hygiene, and then I would leave the room. And that is how I would place a Foley catheter and remove a Foley catheter for a female. Thank you.